It's Wednesday, and that means it's time for Healthy Living. Today, MRI technologist Scott Ferguson joins us to talk about Indiana MRI and what patients can expect when they visit. Thanks for joining us this afternoon.
Thank you for having us.
We'll kind of talk about the need for an MRI and kind of what that means for patients. If they're sitting at home wondering about that.
Well, in case you don't know, an MRI stands for magnetic resonance imaging. It uses a very large magnet and specially tuned radio waves that produce high-resolution images of the inside of the body. So we can investigate almost any body part that you're having issues with. If there's been an injury, such as a joint sprain, back pain, or if you've had a history of brain trauma, looking for stroke, tumor, we can just about investigate anything. And it's non-invasive. You can just lay there while we take the images. The unique part is we can look in any plane without actually having to move the patient around. So all they have to do is lay there and relax, and we do the work on computer.
A very simple test.
Yes.
It only takes a matter of a few minutes then to get them set up and everything.
Yes, to get set up, and we provide earplugs for the patients. It's very noisy. It's just critical that they be able to relax and hold still, and we do our best to get everyone very comfortable. And it takes about an average of a half hour to 45 minutes for most MRIs.
Okay, and I noticed we were talking about some people are claustrophobic and maybe a little leery of these machines. Kind of talk about that.
Right. There's two different types of magnets. One's called a high field, and it looks kind of like a long tunnel. It's the traditional MRI people are probably familiar with. We, at Indiana MRI, we have an open-sided magnet, which is larger. If you're a larger patient or claustrophobic, we can put you in this one, and they can see daylight all around. And it's much roomier, more comfortable. And it's not as noisy either. And if you're really nervous, you can have a family member sit in the room with you.
So you can accommodate pretty much anybody with any kind of need that exists then.
And if necessary, we have nurses and our radiologists. We can order medication either to be taken before the MRI at our center, or it can be called into a pharmacy to be taken about an hour before the scan.
And then talk about after you guys do the scans, you do the tests, how long does it normally take to get these results back?
Usually within 24 hours. And we just recently got a new computer system called a PACS, which allows us to transfer everything digitally, so your images can be viewed really anywhere in the world. You just have to set your doctor up with a password, and they can view them online through our website. So
Great.
Almost immediately.
So it's a simple procedure,
yes.
Painless, obviously. You can accommodate everybody, and you get the results back fairly quickly.
Yes.
That's great. And anything else you'd like people to know about this that they may not know, folks sitting at home?
No, I think that's about it.
Yeah, and it's important to get these tests done, obviously.
Oh, yes. Yes, they're becoming probably the predominant testing modality. It's almost taken over CT and X-rays. In the past, people went through a lot of other steps before they got an MRI. Well, now if you twist your knee or you're having severe back pain, a lot of times they don't waste time. They go straight to the MRI because that's kind of the telltale exam to determine if you're going to need surgery.
Great. Thank you so much, Scott. I
Thank
appreciate
you.
it. Scott from Indiana MRI. Again, our Healthy Living segment airs here on Wednesdays. For more information on healthy living, be sure to check out our website at WTHI-TV.com. News 10 at midday. We'll be right back. Stay with us.